This is a talk on CPAP. CPAP stands for Continuous Positive Airway Pressure. It's a type of non-invasive ventilation whereby a continuous flow of gas is delivered to the patient during both inhalation and exhalation. The fact that there is a positive pressure being delivered during expiration enables the lungs to be splintered open, maintaining the functional residual capacity, preventing collapse. Imagine you're holding your head out the window whilst driving down the motorway. It's easy to breathe in, but more difficult to breathe out as you're having to go against the air. This is like what CPAP does. A normal breath in is active and a normal breath out is passive. But in CPAP's case, the positive pressure makes inhalation positive and exhalation active as you're breathing against the positive pressure. Indications for use include Type 1 respiratory failure. This is because positive pressure is being blown during exhalation. It is more difficult to remove CO2. So if CO2 retention is common in the patient, do not use. Indications for use for CPAP include Type 1 respiratory failure. This is when oxygen levels are significantly low, but CO2 levels are okay. The positive pressure reinflates the alveoli, which improves gas exchange. This increases oxygen saturations. However, if CO2 levels begin to increase, CO2 retention is occurring. Because the positive pressure is continuous, it's difficult to blow off CO2 against the pressure. So CO2 retention is a risk and levels will need to be monitored. Other indications for CPAP include neuromuscular disease, congenital heart failure, chest wall trauma and atelectasis. There are contraindications for the use of CPAP. This includes, like I said, the risk of CO2 retention. It's also facial trauma from where the mask has been fitted, undrained pneumothorax, secretions. This is because if the mask is attached to the patient's face, it's difficult to remove it so that they can't remove their secretions. There's also a risk of fatigue because they're blowing against this positive pressure, and also nausea and vomiting for the same reasons that they can't remove the mask. This is a non-invasive ventilatory device that can deliver different support modes. This mode is set to CPAP. This bit here, that's what the pressure is set at, so this is set at 5. This ramp time and ramp start is not used in acute settings. It will be discussed further in the teaching session. This column here is what the machine's set at and shouldn't change. This is the patient data and is telling you what happens each time the patient takes a breath. There's the respiratory rate, the tidal volume, the minute volume, and this bit here is called leak, which will be discussed further in the mask fitting. This apnea is if the patient stops breathing of any length of time, the machine will alarm. This is showing you that it's set at 5 and it will remain pretty static as the patient's breathing through the device, and it can be compared to the BiPAP, where in BiPAP it will fluctuate more.